Hi, I'm Dr. John Chessare, the President and CEO of the GBMC Healthcare System, and I'm here today to give you an update on the viral respiratory tract surge in infections that has truly affected children more than adults. So there is some good news. 5 out of the last 6 days, the Pediatric Emergency Department at GBMC has seen fewer than our recent average of 45 children per day. This may be an indicator that this surge is starting to go away. We don't know if we will have other surges of respiratory tract illness. A reminder, this surge is earlier in the year than we normally see it, and a big factor causing that is the fact that young children, especially toddlers, 3 and 4-year-olds, have not had the exposure to viral respiratory tract illnesses that they would have typically had because of the pandemic. During the pandemic, their older brothers and sisters were frequently not going to school, and when they went to school, they had masks on. Their parents had limited their exposures and were also wearing masks. So for this reason, children have not been immune to these viruses because they didn't get sick with them in previous years, and now they're getting them and the exposure all at once. What we don't know is, will there be other peaks in different respiratory tract viruses as we progress into the winter? Some of you may have seen on the national CNN broadcast yesterday, our lab informatics coordinator, Mr. Abi Pokarel, told the story of his child Ira, who had gotten sick with RSV, very seriously ill. And our colleague Abi praised the GBMC ED staff, the physicians, the nurses, the technicians, for having essentially rescued his baby. And the baby has had an excellent health outcome. Let's talk a little bit about what should you do if your child is ill. Again, if your child has a bit of a cough and is acting normally, treating the child with acetaminophen or ibuprofen if necessary for their symptoms is a good first step. If you have any question about your young child's illness, please call your primary care provider. Obviously, if the child is exhibiting any signs of difficulty breathing, that child needs immediate attention and should come to the emergency department or call 911 for assistance. What should we all do, especially with Thanksgiving this week? I had a family member call me to ask me what should they do with their 5-week-old baby. Should the baby go to grandma's house for Thanksgiving? Again, we want to limit the exposure of young children to these viruses. So staying home is not a bad idea, especially with a very young child. If you are going to take your young children to family members' homes, you should remind everybody to wash their hands and to wear masks around the young children. You should, again, know who has been immunized against COVID and who has not. It would be wonderful if everybody has been immunized against COVID and everybody has had their flu shot. Independent of the Thanksgiving holiday, thank you for keeping up to date with your flu shot and your COVID shot. Let me end, as usual, by thanking the staff in healthcare everywhere but especially staff members who have been caring for children during this latest surge. Let me thank the physicians, nurses, technicians, and other clinicians in the GBMC emergency department. They have done a phenomenal job of serving the community. And again, while many other hospitals in the area have closed pediatric services or limited pediatric services, we have not done that at GBMC, and our staff has been there to care for a very large number of children. Let me thank them again. So happy Thanksgiving to everyone. We hope that this surge is now going to continue to show fewer children getting sick and fewer adults, for that matter, getting sick. If you are ill and you need help, we are here to help you at GBMC. Thank you very much and happy Thanksgiving.